Hello, my name is Dr. Neil Baum. I'm a urologist in New Orleans, Louisiana, and I would like to take this opportunity to talk with you about stress urinary incontinence. This is a common condition that affects millions of American women. In this 7-minute video, I will talk with you about the symptoms of stress incontinence, the causes of stress urinary incontinence, and what treatment options are available for this common condition. So what are the symptoms of stress urinary incontinence? Usually it is leakage of urine associated with coughing, sneezing, lifting, high-impact exercises, and even sexual activity. Now, how does stress urinary incontinence occur? There is normally a seal effect on the urethra, or the tube that exits the bladder. That seal is normally very tight and completely closed when a woman wishes not to have any leakage or urine coming out. However, if that seal is relaxed or open, the stress urinary incontinence will occur. It occurs with multiple pregnancies. It occurs with chronic coughing. It occurs as a result of smoking, even straining to have a bowel movement, any prolonged or heavy lifting, and it is quite common after menopause. Now, how is stress incontinence treated? Usually it is tried to be treated without surgery in the beginning, with conservative management consisting of behavioral therapy and physical therapy exercises. And if that doesn't work, then surgery is an option. Let's talk about behavioral therapy, which consists of education in terms of voiding habits, how to prevent the suppression of the urge to urinate when you have to go to the bathroom immediately. Also, time voiding. Your doctor can talk to you about increasing the interval between urination. Also, there are certain foods and fluids that are bladder irritants, and if these are avoided, then the problem of urinary incontinence can be alleviated. Also, there are lifestyle interventions, such as food and fluid restrictions, especially under certain social circumstances when you want to avoid the problem of urinary incontinence. I also recommend, if you are a smoker, to avoid smoking, and also consider a weight loss program if there is a problem of obesity, being overweight. Another option is that you should have regular bowel habits, and also there are exercises that can be done that will improve your ability to maintain continence and control of urination. Fluid management is one of the easiest things to do, and many women will try to withhold withhold fluids to avoid urination. It is noted that if you decrease the fluid intake, your urine becomes more concentrated and it becomes very irritating to the bladder lining. It is recommended that you consume about 6 to 8 cups of fluid a day, and water is the best. Smoking cessation is very important for control of urinary incontinence. If you are a smoker and you have incontinence and you're looking for a motivation to discontinue your smoking, the urination problem may be that kind of motivator. Smoking increases the risk of all forms of urinary incontinence. It can directly impact the bladder. The nicotine can irritate the bladder lining. It reduces the blood flow to the lower extremities and to the pelvis. And also, smokers often have a chronic cough, which weakens the muscles in the pelvis. Weight loss is another important consideration because obesity increases the risk of stress incontinence. Also, point out that obesity increases your risk of diabetes. Important to try to gain control of your bowel habits. If you have constipation and you're straining to pass your stool, this will also weaken the muscles of the pelvic floor. Now let's talk about pelvic muscle training. And that is, there are exercises that you can do to strengthen the pelvic support. About 50% of women will make an improvement if they use pelvic muscle training. The way that you do this is with Kegel exercises. Kegel exercises increase the strength of the muscles in the pelvis. If exercises don't work, there are pessaries. A pessary is a donut-shaped organ, donut-shaped device that is placed into the vagina that repositions the urethra and the bladder. If pessaries don't work, then there are injections and surgical procedures. Injection therapy consists of injecting a material, either collagen or a non-absorbable material, around the urethra. It can be done in the office or in the hospital. It's a very short procedure, takes about 10 minutes. It's very minimally invasive, it's very safe, and it's also very effective to do. Injection therapy often requires repeated injection because there is absorption of the material, and some women may need 2 or 3 injections in order to achieve continence. Finally, I want to mention surgical procedures. There are surgical procedures that can be accomplished that can elevate or restore the urethra to its normal anatomical position. There are a number of tapes that are available that can be inserted into the vagina, usually under a local anesthetic or IV sedation. The procedure takes 15 to 20 minutes, and the women are completely dry after the procedure has been completed. The mid-urethral sling is one of the best procedures for controlling urinary incontinence. It has an 85% success rate, and it has minimal recovery time. Usually most women can return to gainful employment and all activities, including sexual intimacy, 2 to 3 weeks after the procedure. In summary, stress urinary incontinence is a common condition affecting millions of American women. Conservative treatment is available and is the first option for treating stress urinary incontinence. Only when conservative treatments fail is surgery considered a treatment option. Successful treatment is available in most cases. Bottom line, you don't have to depend on Depends. I hope you have found this video helpful and useful. If you have any additional questions, I encourage you to go to my website, www.neilbaum.com, or you're welcome to contact my office at 504-891-8454. Thank you.